there and welcome. My name is Denise Fogel and today we're going to discuss Primetime Health Plans 2021 Medicare Advantage plans. First, I'm going to educate you on Medicare. Then we're going to discuss how Medicare works with a supplement plan. We'll then talk about Part D, prescription drug coverage, and lastly, Medicare Advantage plans, then specifically Primetime Health Plan. One thing I want you to take away from this meeting today is that Medicare Supplement and Advantage plans are not the same. My goal is to educate you on the differences. So first we're going to talk about the Medicare alphabet. Medicare is made up of 4 parts, Part A, B, C, and D. And when you're eligible, you'll receive a red, white, and blue card in the mail with Parts A and B. Part A is also known as hospital insurance. It covers inpatient hospital stays, skilled nursing, hospice, and home health. Part B is also known as medical insurance, and it covers things such as doctor's office visits, lab work, outpatient surgery, physical therapy. Medicare Part C and D were created by Medicare, but they are only offered by insurance companies that contract with Medicare. Medicare Part C is an Advantage plan. It is designed to take over for Medicare A and B by combining hospital, medical, and drug coverage all in one. Part D is coverage for prescriptions only. Medicare is insurance, so it has monthly premiums. Most people will receive Part A cost-free as long as you've worked 40 quarters. This is because you paid Medicare tax while you were working. If you worked 30 to 39 quarters, you'll pay $259 per month. If you worked less than 30 quarters, you'll pay $471 per month. So not everyone will pay for Medicare Part A. However, everyone has to pay for Medicare Part B. Even if you enroll into a Medicare Supplement or Medicare Advantage plan, you still pay Part B. The monthly premium is deducted automatically out of your Social Security check. And depending on what your income was 2 years prior to getting Medicare Part B, you may pay more than the $148.50 monthly premium. The next 2 slides will show income brackets. If you had high income, you'll pay extra for both Parts B and D. This is called the Income Related Monthly Adjustment Amount, or IRMA. So on this slide, you can see on the left side your yearly income in 2019, and you can follow the brackets down, and it's based off of your individual or joint income tax return 2 years prior. So on the left side of this slide, if you filed individual and made $88,000 or less, or filed jointly and made $176,000 or less, your Part B premium is $148.50. You can move down the bracket to find your income, then slide over to the right side to see what your premium would be. As I mentioned on the last slide, find your income and move to the right to see what you'll pay in addition to your premiums. So the last 2 slides we talked about how much monthly premium you have to pay for Medicare. This slide will give you an idea of what your out-of-pocket cost would be if you use Medicare only for hospital care. You have to pay the first $1,484 Part A deductible before Medicare pays 100%. Now that is per 60-day benefit period, and you might be asking yourself, well, what does that mean? A benefit period is defined as a benefit period begins the day you go into a hospital or skilled nursing facility and ends when you have been out for 60 days in a row. If you go back in the hospital after 60 days, then a new benefit period starts and the deductible happens again. 2021 inpatient day 61 through 90 is a $371 copay per day. 2021 inpatient lifetime reserve days, 91 through 150, are $742 per day. Skilled nursing facility. Now, folks, one very important thing about a skilled nursing facility, not to be confused with nursing home. Skilled nursing facility is for short-term stay, not long-term care. So days 1 through 20 is a $0 copay. Days 21 through 100 is $185.50 per day. And beyond days 101, it is not covered. It is considered self-pay. Home health and hospice are also covered at 100%. So now let's talk about Medicare Part B costs. Examples of Part B services are doctor's office visits, lab work, emergency room, urgent care, chemotherapy, radiation, diagnostic testing, medical supplies, outpatient surgery, rehab, and ambulance. The Part B deductible is $203 per year. Once you've met the deductible, now Medicare pays 80% and you pay 20%. But one thing to keep in mind, there is no out-of-pocket maximum for Parts A and B on Original Medicare. So you might be wondering, how do I enroll in Medicare? If you're receiving benefits from Social Security or the Railroad Retirement Board prior to age 65, you will automatically be enrolled in Medicare Parts A and B on the first day of your birthday month, unless your birthday is the first day of the month. For instance, if your birthday is October 1st, your Medicare Part A and B effective dates would be September 1st. If you're not receiving benefits from Social Security and you want Medicare the month you turn 65, you must enroll by contacting the Social Security Administration. You may also be eligible for Medicare after you've been on Social Security disability after 24 months if you're under age 65, and there are some exceptions. So this slide is going to give you your options on how to enhance Medicare. The left side of the chart or screen is what we call option 1. You have Original Medicare, your Parts A and B, a Medigap or a Medicare Supplement plan, and then a drug plan. Just to give you a quick summary on Medicare Supplement plans, there are 11 standardized plans available. They can cost anywhere between $60 to $300 a month. They're designed to pay second to Medicare, which can help pay the cost we talked about on the last couple slides. Medicare supplement plans allow you to use any doctor or hospital of your choice because there are no networks to follow. Since Medicare pays first, the supplement plan pays second. However, they don't include drug coverage. That's why you'd need to buy a Part D plan. Part D plan will cost anywhere between $15 to $80 a month. You may be thinking, well, I don't take prescriptions, so I'm not going to get a Part D plan. Well, just remember, if you don't get Part D when you're eligible, you can get penalized for not having it. This is called the late enrollment penalty, and we'll talk more about that later. Just keep that in mind. So now let's talk about option 2 on the right side, a Medicare Advantage plan, also known as Part C. Medicare Advantage plans were created by Medicare to allow insurance companies to take over for Medicare. Insurance companies have to contract with Medicare annually and follow all Medicare rules to sell them. So in a nutshell, Medicare pays insurance companies to completely take over for them. So when you join an Advantage plan, you no longer use your Medicare card. You use the insurance company card. Medicare Advantage plans combine A, B, and sometimes D all in one. But remember, you're still going to pay that Part B premium. There are eligibility requirements to be on a Medicare Advantage plan. You must be enrolled in Medicare Part A and B, and you still pay that Part B premium. Now, it could be higher than other people due to the IRMA, or the Income Related Monthly Adjustment Amount. That was the high income slides we talked about earlier. Also, with eligibility requirements, you must live in the planned service area. Specific to prime time, you must live in Carroll, Columbiana, Harrison Homes, Mahoning, Medina, Portage, Stark, Summit, Trumbull, Tuscarawas, and Wayne County. CMS, which stands for Centers for Medicare and Medicaid Services, contract with private insurance companies to manage your Part C benefits. So Primetime Health Plan HMO-POS. HMO stands for Health Maintenance Organization. We have to contract with Medicare. We do not require referrals for a network specialist. So basically on Primetime, all your doctors have to be in our network. You can find out if your doctors are in our network by looking at our provider directory. You can view our provider directory on our website at www.pthp.com, or you could call our customer service department to find out. Now, there are some exceptions as far as seeing network doctors, and those would be for emergency room, urgent care, and dialysis. You may use any emergency room, urgent or stat care, or dialysis facility when you are on Primetime Health Plans, Medicare Advantage plans. Point of service, specific to Primetime, allows you to get your lab work done at any provider except for genetic testing. You may also choose to use any dentist and optometrist or purchase your eyewear anywhere. Next chart is a little busy. This is our 2021 benefits chart. So across the top in the blue bar, you will see the benefit category, and then you will see the basic MA only plan, the ultimate plan, the classic plan, and our plus plan. So these are our 4 Medicare Advantage plans for 2021. The basic MA only plan is the only one of our plans that does not include prescription drug coverage. So I'm going to go down the left side of the screen in the benefit categories, and then I'm going to read the cost associated with each of our plans right across the board. So the plan premium. And remember folks, this is in addition to your Part B premium. Plan premium for basic MA only and ultimate is $0. Classic is $39 and plus is $89. Medical deductible across the board, 0. So there is no medical deductible on any of our Advantage plans. Max out of pocket, very important number when shopping Medicare Advantage plans. And that is because this number represents your financial liability for copays throughout the entire year. Once you've paid out the copays of out-of-pocket max, the rest of the year you would be covered at 100%, except for prescription drugs. Those do not track toward the max out-of-pocket because they track toward something called the coverage gap or the donut hole, and we'll talk about that a little later. So the max out-of-pocket for the basic MA only plan is $3,400. The ultimate, it is $4,500. Classic, $4,200, and the plus plan, $3,900. Inpatient stay. So on Primetime's Advantage plans, you are required to pay a copay per day for days 1 through 6 on each of our plans. The copay on the basic MA only is $275, ultimate $290, classic $280, plus $270. Skilled nursing facility. On the basic MA only, days 1 through 20, you would pay a $20 copay per day. Days 21 through 39, you would pay a $150 copay per day, and days 40 through 100, the copay drops back to 0. The Ultimate, Classic, and Plus, the first 20 days, no cost, no copay. However, days 21 through 45 on Ultimate is a $150 copay, Classic $135 plus $120. Days 46 through 100 on Ultimate, Classic, and Plus, the copay drops back to 0. Home health care and hospice, our members pay zero copay on all of our plans for those services. PCP, which stands for primary care doctor, or I'm sorry, primary care physician. Basic MA only, zero copay. Ultimate $5 copay, Classic and Plus, zero copay. Specialist, $40 copay on both Basic MA only and Ultimate. Classic plan 35 plus 30. Chiropractor, $20 across the board. Ambulance, Basic MA only, $200 copay. Ultimate $230, Classic $210 plus $200. Outpatient or ambulatory surgery. Basic MA only plan, you pay a percentage of 25% up to $1,200 out-of-pocket max. Ultimate plan, you pay a $350 copay. Classic $300 plus $200. Emergency room. Basic MA only, $85 copay. Ultimate $90, Classic $85 plus $75. Urgent care inside the United States, $65 copay on all the plans. Diagnostic radiology. For your MRIs, CAT scans or PET scans, $250 copay on Basic MA only, $190 on both Ultimate and Classic, $175 on Plus. Diagnostic tests, Basic MA only and Ultimate, $100 copay. Classic $80 plus $60. Outpatient rehab, Basic MA only and Ultimate, $35 copay. Classic $30 plus $20. DME, which stands for Durable Medical Equipment. All the plans, you pay 20%. Lab services or blood work, Basic MA only and Ultimate, $35 copay. Classic $30 plus $25. And finally, therapeutic radiology and dialysis. On all of our plans, you are responsible to pay 20% coinsurance. A quick glance at pharmacy and formulary information. So a formulary is just a fancy name for a list of prescriptions we cover. It's really important to check and make sure that your prescriptions are covered under Prime Time's formulary, and you can check by going to our website at www.pthp.com. We have a 5-tier formulary, or 5 different levels of copay depending on the prescriptions you take. Step therapy basically means that there are some drugs have a generic and a brand. In some cases, we might want you to try the generic before we fill the brand. This will help you save some money and keep you out of that donut hole. Prior authorization means that you need permission first before we're going to fill a prescription. Quantity limit. Quantity limit means that some prescriptions, Medicare says that, okay, 1 pill a day should treat your illness, but maybe your doctor prescribed you 2 pills a day. We can lift those restrictions. You would just need to ask us about that. Pharmacy exceptions. In some cases, you might be prescribed a drug that we do not cover on our formulary. You could ask us to cover those for you. Preferred pharmacies. We have preferred, standard, and mail order pharmacies. If you use a preferred pharmacy, you will pay the lesser copay amounts than that of standard pharmacies, and you can also get a 30 and a 90-day supply. The Part D coverage stages. There are 4. The deductible stage, the initial coverage stage, the coverage gap, also known as the donut hole, and the catastrophic stage. We'll talk a little more about that later in this presentation. Extra help is available for folks who might have limited incomes. You would apply through the Social Security Administration. And then late enrollment penalty, or LEP. Did you know that you could get a penalty if you don't sign up for prescription drug coverage when it is first offered to you? We will discuss more about that a little later as well. This slide shows your copays at a preferred pharmacy. Some of our preferred pharmacies are Discount Drug Mart, Giant Eagle, Sam's Club, Walmart, Rite Aid, Walgreens. You'll notice that 3 of our plans are listed: the Ultimate, the Classic, and the Plus. Remember, our basic MA only plan does not include prescription drug coverage. So our Advantage plans with drug coverage do have an annual deductible. The Zero Premium Ultimate plan has a $200 one-time deductible. The $39 Classic plan has a $150 one-time deductible, and our $89 Plus plan has a $100 one-time deductible. It's important to mention the deductible only applies to drugs that fall in tiers 3, 4, and 5. So for tier 1, across the board, all of our plans, whether you're getting a 30 or 90-day supply, 0 copay. Tier 2 generics, on the Ultimate plan, you'd pay $15 for a 30-day supply, $45 for a 90-day supply. The Classic, you'd pay $8 for a tier 2 30-day supply, $24 for a 90-day supply. Plus plan, you'd pay $6 copay for a 30-day supply, $18 for a 90-day. Tier 3, remember, deductible would apply first in anything in tiers 3, 4, and 5. But tier 3, 30-day supply on all of our plans is a $42 copay. 90-day supply, $126. Tier 4 on all of our plans, 30-day supply is a $95 copay. 90-day supply, a $285 copay. Now your Tier 5 specialty drugs are not available in 90-day supply on any of our plans, but you can get a 30-day supply on the Ultimate of 29% of the cost, the Classic 30%, and the Plus 31%. Next slide shows copays at a standard pharmacy. Again, your deductibles still apply. Tier 1, 30-day supply on all the plans is a $10 copay. 90-day supply would be a $30 copay. Tier 2's Ultimate plan, $20 copay for a 30-day supply, $60 for a 90. Classic plan, $18 for a 30-day supply, $54 for a 90, plus $16 for a 30, $48 for a 90-day supply. Tier 3's, again, deductible applies. 30-day on all the plans is a $47 copay. 90-day supply, $141 copay. Tier 4 on all the plans, $100 copay. 90-day supply, a $300 copay. And those specialty, 29% Ultimate, 30% Classic, 31% Plus. This next slide shows our Part D mail order pricing. For 2021, our mail order is through Optum Rx, and we still have those deductibles. So no matter if you get mail order, standard or retail, standard or preferred pharmacy, the deductible is going to apply first to any drug that falls in tier 3, 4, or 5. Again, it's a one-time deductible, not per prescription. So just keep that in mind. Tier 1's mail order across the board, no copay. Tier 2 on the Ultimate, $15 for a 30-day, $45 for a 90. Classic, $8 and $20 plus $6 and $15. Tier 3's, $45 copay for a 30-day supply on all the plans. 90-day supply, $125 copay. Tier 4, $95 copay on all of our plans for a 30-day supply. Now a 90-day on the Ultimate plan is a $285 copay, whereas the Classic and Plus it's a $275 copay. And the specialty, $29 on Ultimate, $30 on Classic, and 31% on Plus plan. So this slide talks about the Medicare Coverage Gap, also known as the donut hole. Not everyone will fall into the donut hole. It's relative to your total cost of your prescriptions throughout the year. So as I mentioned earlier, there's 4 stages. Stage 1's the annual deductible stage. So if your plan has a deductible, you're going to pay that deductible amount up to the deductible amount before you start paying the copays. That would be stage 2, initial coverage. So during this stage, the plan pays its share, you pay your copay. And remember, what you, the member, pay plus what we, the insurance, pay together, that is what is tracking to stage 3, or the coverage gap. So when your copays and our cost exceed $4,130, you fall into stage 3, this coverage gap. Once that happens, you're no longer paying the copays. Now you're paying 25% of the drug's total cost. You pay that increased cost until one of 2 things happens. December 31st rolls around, or your out-of-pocket cost exceeds $6,550. If that happens, you do fall into stage 4. Now your costs are going to go down considerably, and you're going to pay 5% of the drug's total cost, or $370 for generics, $9.20 for all others, whichever amount is greater of the 2. Part D low income subsidy, LIS, are also known as extra help. So if you're eligible for Part D low income subsidy, you can get help with your plan premium, your deductible, your copays, your coinsurance. There's no coverage gap or no donut hole if you get extra help. You also have special enrollment periods, and there are some limitations to that. You can qualify if you're single or married with limited resources, and you can apply by visiting www.socialsecurity.gov. You can visit your local Social Security office, or you can call Social Security at 1-800-772-1213. Part D penalty, or late enrollment penalty. So Medicare calculates the penalty by multiplying 1% of the national average cost of a Part D plan. So in 2021, the national cost was $33.06. So they figure your penalty by multiplying the number of full uncovered months you didn't have drug coverage times 33 cents a month, or $3.96 for a year, and you pay that in addition to your monthly premium for life. The penalty does begin at the time of enrollment. Now you can avoid paying the penalty if you had creditable coverage, like coverage through an employer or through the Veterans Administration. If you receive extra help or low income subsidy, you can avoid the penalty. And also, if you sign up for drug coverage when you're first eligible, you can avoid that penalty. Additional benefits that are not covered by Medicare. So that's one perk to being on an Advantage plan. Advantage plans can offer some routine dental and vision, hearing aids, gym membership, or over-the-counter items. So for 2021, our basic MA only gives you a $300 per year combined dental and vision benefit. You get a routine hearing exam and hearing aid, a $100 allowance every 3 years. Contact our company that we teamed up with called Amplifon, and they can provide you with providers in the area and the hearing aids that are available at the $595, $695, or $895 copay. A gym membership through Silver and Fit. This allows you a free basic gym membership to a facility that is in their network. And for those folks who might not want to go out to a gym, they do offer some home fitness kits you could use instead. Over-the-counter items. We provide our members with a catalog, and you can shop that catalog and purchase over-the-counter items at no cost to you. Now, the basic MA only plan does not include the over-the-counter items. Our ultimate plan has a $100 combined dental vision. You'll also get the hearing aid, the gym membership, and a $50 per quarter over-the-counter item. The Classic plan has a $300 per year combined dental vision, the hearing aid allowance, the Silver and Fit gym membership, and the $50 per quarter over-the-counter item. The Plus plan has a $350 dental vision benefit, $100 allowance with the Amplifon, Silver and Fit, and a $75 per quarter over-the-counter item benefit. Medicare Advantage election periods. The initial election period is a 7-month window surrounding your 65th birthday. The annual enrollment period happens every October 15th through December 7th. That is when folks who are on a Medicare Advantage plan, if they'd like to make a change for the following year, you must do so between October 15th through December 7th. The Medicare Advantage open enrollment period happens every January 1st to March 31st. During this time frame, if you joined an Advantage plan without fully understanding how it worked, you would have an option to go back onto original Medicare or switch to another Advantage plan. Special election periods. If you're losing employer coverage due to retiring, you would have a special election to join a plan outside of the other 3 election periods. Maybe you move in or out of the plan service area. That would also give you a special election. Or if you qualify for Medicaid or extra help, this would also give you a special election. Okay, this next slide talks about important information. Health and wellness is the first one. Any wellness service that Medicare covers at 100%, we also have to cover at 100%, such as your annual wellness visits, colorectal cancer screenings, diabetes screenings, lung cancer screenings, etc. Some services that are not covered, custodial care, private duty nursing in the home, an ambulette, or room and board in a nursing home. Our disease and case management. We have a nursing staff in-house that can help members who have chronic conditions and maybe follow your case. If you need certain care and treatment, we want to make sure that you're getting the best available to you. Enrollee rights and responsibilities. You have the right to be treated fairly. You have the right to make a complaint, and certainly making sure that your doctors are in the network of a Medicare Advantage plan. That's huge. That's the one thing that we in the sales department, that's one of the first things we look at when anyone is coming to us, is checking your doctors, making sure they're in our network. Our privacy practices, we do not share your health information with anyone unless you've given us written or verbal consent to do so. Grievances and appeals for medical and prescription. A grievance is a complaint. You have the right to let us know if you have any complaint, or if maybe we did not cover something or approve you to take a certain prescription or go out of network. You do have appeal rights as a Medicare beneficiary. Our multi-language interpreter services. We have the means to provide interpreters if need be, or translation if you speak another language, and we never discriminate. So the plan star ratings. We know that comparing Medicare Advantage plans can be confusing. Star ratings are an easy way to compare the quality amongst healthcare plans. Star ratings grade Medicare plans based on how they perform, including customer service, member satisfaction, pharmacy services, and member health and well-being. Primetime's consistent star rating performance aligns with consistent value we offer to our members. With each year, we continually work alongside our healthcare providers to give members access to care they deserve. And we also continue to provide our members with programs and services they need to lead a life of good health and well-being. So I'm very proud of the fact that Primetime Health Plan is a 4.5 star rated plan for 2021. So how do you enroll in Primetime, and how do you pay your premium? Couple different ways you can enroll. You can go to our website. Again, that's www.pthp.com. You could request a brochure and mail in the paper enrollment application in the back of our brochure. You could go to Medicare's website to enroll at www.medicare.gov. A couple different billing options. You can choose to get a monthly bill, or you can choose to have us auto deduct out of your checking account. That's called the EFT. Or you can even have Social Security withhold your premium right out of your Social Security check. And once we receive your enrollment, we will send you a welcome packet. You will receive 2 member ID cards. And 2 folks, if you are assisted in enrolling in an Advantage plan by an agent, a salesperson, or a broker, just know those folks can be paid commission based off of your enrollment. So why choose Prime Time? You know, we're local, we provide quality care. We've got a fantastic and personalized customer service team. You get 1 ID card, care coordination services, our telehealth services, including Teledoc. You know, in this day and age with people not wanting to be out and going and sitting in a doctor's office, you know, it's really nice you can call a doctor on the phone. Of course, your PCP or specialist copay would apply. No cost Medicare education by trained specialists. My coworkers and I, we go out into our community and provide, it's called the ABCs of Medicare. We really believe that you got to understand Medicare first before you can even begin to understand how an Advantage plan or a supplement plan work. So we go out and we try to help educate folks. That way you can make your best decision for your needs. And with Prime Time, you have worldwide coverage for emergency and urgent care. And how to tell which plan is right for you, make sure you're looking at those plan benefits. Verify that your doctors and your pharmacies are in the network. Review the formulary. Make sure your prescriptions are covered and find out what tier they fall in. Those would be the best suggestions to help you find the plan. And then too, remember what I said about the star ratings. You know, that's a great way to see Medicare's grade on Advantage plans. So contacting Prime Time is very easy to do by phone. Our customer service department is open Monday through Friday from 8 to 4:30. From October 1st to March 31st, our call center is open 7 days a week from 8 a.m. until 8 p.m. Now, normally we used to offer walk-ins. Unfortunately, due to COVID-19, walk-ins are not available right now. But if you have any questions, please don't hesitate to call customer service at 330-363-7407 or 1-800-577-5084. And that is the end of this presentation. I thank you so much for your attendance. If you have any questions, please don't hesitate to give us a call. Again, our customer service phone number is 330-363-7407 or 800-577-5084. Thanks so much. Have a great day.